Welcome, everyone, and thank you for coming. Really excited to see so many of you here and to see some great familiar faces and partners and some folks that we haven't seen in a while. Um, I just really appreciate you taking the time to join us. As most of you probably know, I'm Ann Gaish. I'm the CEO here at FamilyWise. And it's exciting to have this chance to share news and updates with you. Bruce was talking about how busy it's been, and I can certainly relate to that. We also have Susie Voss with us here today. Susie is our training manager. She leads coordination and facilitation of several training programs here at FamilyWise. So in a few minutes, we'll hear from Susie about a few of those initiatives within our training institute. But before we get to that, let me start out by sharing a few organizational updates. And for those of you who joined, we had a little bit of conversation kind of about the air quality. Today is a lovely day, but it's also been very hot. And we know that the air quality has been and will continue to be a problem for Minnesota families this summer. The families that we work with are likely to be disproportionately affected. So we're finding resources to support their well-being. Everything from recommendations around cool indoor spaces. Sometimes we're helping families source air conditioners or air purifiers. And we've gone back to ordering masks so that, especially for those families that are reliant on public transportation, that they are able to have some protection when they're outside. And then I do want to acknowledge that we know that our partners across the state and families across the state continue to be significantly impacted. So it's just something we all need to keep in mind as we're looking at supporting families. I also wanted to share a little bit about some of the statewide prevention efforts that we've been doing over the past quarter. As many of you know, April is Child Abuse Prevention Month. We held our annual fundraiser, the Celebration of Family Wellbeing, which brought together nearly 100 supporters and raised more than $26,000 for FamilyWise programs. During that month, we also distributed a social media toolkit to our partners to amplify messages about the importance of strengthening families to keep kids safe. And during that month, we also published our 5th annual Family Wellbeing Index. We shifted it a little bit this year to really explore how Minnesotans may be impacted by federal cuts and how our lawmakers, community-based organizations, and individuals can help sustain families through the challenges that we know are coming ahead. Several nonprofits like the Minnesota Budget Project and the Metropolitan Alliance of Connected Communities contributed their perspectives to this year's report, which you can find on our website, and I suspect it will be linked in our chat momentarily. And then more recently, in June, FamilyWise held the 9th annual Growing Resilient Communities Gathering. This is a virtual conference that brings together changemakers dedicated to addressing the root causes of childhood adversity and to building communities that strengthen families. This year's event explored how each of us can cultivate solidarity and connection in our communities, because we know that collaboration and mutual support are vital during times of uncertainty and times of resource scarcity as we are experiencing today. More than 200 attendees joined us to hear from thought leaders like Dr. Roy Wade Jr., a leading researcher on adverse childhood experiences that we call ACEs, in the Division of General Pediatrics at the University of Pennsylvania School of Medicine, and Dr. Megan Rides at the door from National Native Children's Trauma Center. You can read an event recap and find session recordings on our website, and probably again in our chat. And then last month, we got to reconnect in person with our partners at Prevent Child Abuse America. So they joined us to do a site visit that allows us to be rechartered as Prevent Child Abuse Minnesota. We are deeply committed to preventing child abuse before it starts, and we're proud to be the home of Prevent Child Abuse Minnesota. The rechartering visit provided an opportunity to celebrate our successes as a leader in prevention and best practices in child welfare, and it gave us an opportunity for deeper collaboration with Prevent Child Abuse America in areas that we're working on growing our efforts, like public awareness, research, and advocacy. And then I wanted to provide you one last update that we haven't talked about much in these calls. But you may know that last year, FamilyWise sold our St. Paul building, which had been used pretty much exclusively for supervised parenting visits. We thought as the board was looking ahead to kind of like what the future might bring, It would be a smart move because it allowed us to reduce our operational expenses. But it's also allowed us to explore the opportunity for satellite sites for services in the East Metro and beyond. It'll allow us to be kind of more flexible as we look at different locations. So we're really excited to share that we launched a new partnership with Tubman this year, and we're offering supervised parenting visits at their Maplewood location. Parents engaged with Tubman have expressed interest in connecting to parent education support and will now be able to meet parents literally where they are at with supportive services. So those are a few things that have been happening here at FamilyWise. Now I'd like to introduce Susie Voss. She's the training manager at FamilyWise. Susie started at FamilyWise providing direct services to families. I actually think in our supervised parenting program before she transferred to Wraparound. So she's worked across our organization. And it's been, I'll let Susie say, but 8 years, 10 years?
12.
12 years. Oh my gosh. See, time goes by really fast. Today, Susie is cross-trained to facilitate wraparound training. So she's a wraparound coach and is trained to do near science training across the state. She plays a lead role in coordinating our annual gathering, and she's here to share a bit about FamilyWise's expanding efforts to build the capacity of communities to support families. So Susie, I mentioned the gathering earlier. Do you have like a highlight from this year's gathering that really stands out to you?
Yeah, I think also I'll just say hi everyone. Nice to be here and nice to see some new faces and some familiar faces. Maybe a couple that have known me since I started 12 years ago. So excited to be speaking with you a little bit. Yeah, the gathering is such a cool event, and I feel lucky to be part of the planning team for it. And you mentioned that we had Dr. Roy Wade as our keynote speaker, and I think that was just a huge, huge highlight for me. I thought he, like, if anyone is interested in going back and looking at some of the recordings, I think he just did such a cool job of bringing his expertise and applying it to, he had done a lot of research about our communities in Minnesota, and he made some really cool connections that just felt really individualized to our community, which was really cool. And in our near science training that we do around the state, we reference his research every time we talk about it. And so just I felt a little starstruck too, I think, to have him in our midst virtually. And then I would say just in our kind of a little more peek behind the curtain, as we kind of debriefed with our planning team and with all of the hands that put on this event. I think we really felt proud of our small and mighty planning team, and particularly like running all the tech for the virtual event. That was feedback that multiple people shared that just felt like, yeah, we as a team, we allowed the virtual event to run smoothly and collaborated to move through hiccups. And I think the audience just had a really smooth experience. So I feel really proud of that.
It's really neat. I would say, I think one of the things that always stands out to me about what Dr. Wade shares is his focus too on not just like individual adverse childhood experiences, but adverse community experiences and how that affects children and their families. So, and that did feel like it was really salient this year in particular. It was a great how he individualized it to Minnesota. So, can you give us a little bit of an overview when we talk about kind of the Training Institute? What kinds of trainings does FamilyWise offer, and who do you see as kind of the primary audience for the different trainings?
Yeah. So we have named a couple of them just in our conversation so far, but I kind of think of, we kind of have two big categories of trainings. So one being more like skill and program training. So Anne has mentioned that I kind of came up through our wraparound program, and that is one of our major areas of training. So now we train other agencies, other nonprofits, sometimes like county groups. We're training folks in other states too to start and implement wraparound programs. Another one that's kind of in that category of more like skills training, I would say, is our Circle of Parents training. So we train folks that are interested in being able to facilitate a circle of parents group. So kind of that like technical support hat that like we're training the people doing the direct work with other people. And then our other big bucket of training offerings is the neuroscience work that we do, which we've talked a little bit about. So I think of that more as education than training, actually. It's more of a presentation that we give, kind of a 101 presentation on brain science and adverse childhood experiences and resilience and epigenetics research. So that is what NEAR, that acronym stands for. And that is statewide, many different groups. We really, the kind of why or the mission behind that presentation is we really feel like everyone and anyone benefit from understanding how our brains work, how our experiences have shaped us. And so really our mission is just to get the word out really broadly about those areas of science, so that we can understand ourselves and each other better. And we feel that that really is a cool layer with direct service work too. So when we can, we try to build in a neuroscience presentation when we're doing wraparound training, for example. But yeah, I would say those are kind of our big buckets. And then audiences, I mentioned a little bit for our skills training, often are kind of, for wraparound, it's more like case management type agencies who do similar work to that, or who do work similar to FamilyWise often. But it can really live in many places. And then Circle of Parents is also just very community focused. Anyone who is a parent can volunteer to be a group facilitator. So that's really cool and accessible. And then our audiences for neuroscience presentations are pretty broad as well. We present often in school settings, to community groups, sometimes like faith-based settings. And then we've done some specific work kind of customizing and tailoring that presentation specifically to early childhood educators in that sector, and thinking about those folks who are working with kids in that really tender young age and how vital they are as protective factors. And then also we've done some work tailoring that presentation to like a corrections audience. And so both for people who work in the corrections field, but also we've had the opportunity to present to incarcerated people themselves too. So really broad, and also we have the opportunity to make it pretty specific sometimes too.
Great. So you talk about like wraparound and training. The training part of that is kind of a newer piece for FamilyWise. And I think sometimes people like struggle with, what does that look like? Because, do you have a degree in wraparound? How do you work that? Can you share a little bit about like what the training actually looks like and how we're supporting partners to expand wraparound throughout the state?
Yeah. So wraparound has kind of a cool model where the curriculum developers really want organizations to be able to have sustainability within their organization. So when I started in wraparound 12 years ago, before we were training at all, I was trained in to do the direct service work. And then a couple of years later, I had the opportunity to be trained as a coach. And so that role is somebody who can kind of mentor and train in the direct service role. And so there are these layers of training kind of built into the program, if that makes sense. And so then there's above a coach, there's another kind of consultant role. And so internally at FamilyWise, over my time, we have kind of grown our own program to have each of those roles. And at times we've had multiple coaches supporting the direct service staff. So it's kind of a cool, like expert peer kind of role. And so that really naturally translated to being able to train and support people externally too. And so typically, to do that, we have the kind of consultant role and then the coach role who are supporting, I'll just say like another nonprofit. And so the consultant is really working with the leadership and helping think about what are your funding sources going to be? What is your staff makeup going to be? How are you going to really like implement this program? And then the coach role is really often the one kind of bringing the staff through the training itself so that they can learn how to do wraparound. Um, and so we have an online learning system for that now too. So that has really helped us launch, especially out of state, because we do these. It's a like an independent learning system that people go through. And then we do live, often virtual, we call them debrief sessions. So learners might go through a couple chapters of these modules, and then we get together and do some coaching and learning, and we can see all of their answers and essay thoughts and reflective thoughts through the online system. And then we have this live piece that goes with it to learn the content. And then we also do a lot of like real life field experience observations, and we look at their documentation and make sure they're kind of applying everything they learned in the online course to the actual work with families, because we know there's a difference between what you're seeing online and like how it works in real life. So it feels really important to us to be coaching through that time too. Um, yeah, let me know if there's anything else you want me to share about that too.
How long does it usually take? Like if I'm starting out as a facilitator, because I mean, I think sometimes people think about trainings like, oh, if you want to do parents as teachers, you go to a 3-day training, or oh, you'll go for a week somewhere to do, parent-child observation therapy training. So how is it similar to that, or how is it different?
Yeah, that's a really good question. And I think sometimes when people come to us, they assume it's maybe like a 2-day training that then they can just go run with it. And it's not. It's typically like a 4 to 6 month time period of our book has 18 chapters in it. So there are 18 modules in this online learning system. And then because such a big part of the training is the field work, we just really pace that out so that people are kind of slowly starting to work with families and then building their skills as they go. So yeah, often 6 months is a good estimate. And the cool thing is they can be working with families during that time and getting referrals. So it's kind of a cool, like, it's not like the program can't start for 6 months. It's kind of layered together.
And in some ways, they need to be because
Yeah.
when you talk about some of the field experiences, it's things like, walking through an initial meeting with a family or doing a crisis safety planning meeting or
Mhm.
developing a case plan together. So is that a fair way to describe it?
Yeah, absolutely. Yeah. So you kind of need that real life experience to learn it fully. And it also makes the content learning a lot richer when you start to have an actual family to draw from and kind of apply the examples to.
Right. And again, I didn't say this earlier, but if people have questions, feel free to drop them in the chat or to interrupt us and ask them. But I want to go back to Susie, you talked a little bit about like the near science work that we've doing and that we've tailored the curriculum both for the early childhood community. You mentioned also corrections. I know we also did, especially prompted by the work in the early childhood education community, we did a translation for Spanish speakers. Can you share a little bit about the response that we've received from that work?
Yeah, that's been a really exciting big project over the last like year and a half, probably. And yeah, I'll say I think I feel proud of the way we tackled it. We worked with there was already a version of the curriculum in Spanish, but we worked with native Spanish speakers to review the curriculum and make sure it was translated well, and they gave really good feedback. And we also had a little focus group like look at the slides and the imagery and just see like is this all um, kind of culturally responsive in the way we want to be. So the process itself was really cool, and I think there has been a desire for this curriculum to be in Spanish for a long time, and so it feels like it's just been a long time coming. Um, and so we through our ECE specific work, so at FamilyWise, we give the presentation and then we also train other people to give the presentation because we want the most people to be talking about this as possible. And so we have now trained 4 Spanish speaking early childhood focused presenters. Um, and we have at least 2 more that we're going to be training this fall. So that feels really exciting. And so we had our very first Spanish language presentation in June, so really recently. And I was not at that presentation, but it sounds like based on the survey feedback that we got, it just was super well received. Kate did a good job of compiling the feedback, but it sounds like people found it really helpful. There were a lot of comments about it being helpful for people's own healing and kind of thinking about their tools for self-regulating and co-regulating with kids, because that is a big part of what we talk about in the resilience section. And one cool stat that Kate shared with me is that 100% of survey respondents reported a significant increase in their knowledge about these areas of science. So that feels like just so cool when we know we're getting information to people who are really appreciating it and maybe didn't have it before. So we are hosting a second Spanish language presentation at the end of August, and it's going to be virtual. So we don't quite have a flyer yet, but keep your eyes out for that too. And if any of you are connected to folks that speak Spanish, we're going to be sharing that widely too.
Great. So when you look ahead to the next 6 months, what are you most excited about for the Training Institute?
I think continuing some of the work that I've talked about, like these are early childhood partnership is relatively new. The Spanish presentation is brand new, as I've mentioned. So I think kind of seeing some of those things come to fruition and then like being able to continue that work feels really exciting. The Training Institute has grown in these ways that I've been talking about, so much so that we have hired a training coordinator to support the work. And so that feels really certainly significant for me because it's a person that's directly supporting my work. But I think it really just signifies how far we've come in this work since I started. And I think I mentioned we have a couple, we have 2 presenter trainings coming up this fall too. And then internally, we're also, I've shared we're really focused on wraparound and near science. Like those have kind of been the like flagship training programs that we have. But I feel excited that we're expanding kind of like across the other expertise that we have at FamilyWise too. So we have other like parent support programs that are now, I'm going to be collaborating with them over the next couple of years on some new funding to create some trainings based on their expertise. So it just feels like there's a lot coming that I'm excited about.
Great. Thanks, Susie. So I'd like to open it up for if there are any questions from anybody in the group.
And Carol, I see Carol put a question in the chat, so I can read that. So she said, thanks for sharing additional information on the Wraparound Training Institute as FamilyWise is expanding wraparound training within Minnesota and outside of it. I'm curious what you're seeing as some of the common barriers or challenges that other areas outside of Hennepin County are expressing when providing providing the wraparound process. how is training adapted to support barriers and challenges?
Great question. And for those who don't know, Carol works with Wraparound and knew me when I was a little Wraparound facilitator. I think what's coming to mind for me, kind of my lens on it, is kind of the agency program implementation part of it, more than I don't know if I know as much, if I'm like quite as linked in with barriers that like the wraparound facilitators are seeing, but I know like funding continues to be really tricky. Like, I think we've been really lucky in Hennepin County that our funders understand wraparound is a really intense program. And so our funders in Hennepin County understand that and pay kind of according to that, like how much time it really takes to do wraparound well. And I think a lot of places get a little bit stuck in getting less funding, so they have to take on more families. And that's really not sustainable with the level of intensity that you need to be spending with each family for wraparound. Hopefully I'm articulating that well. So I know that's one thing, just kind of getting like the correct funding rate. And I think different states do that really differently too. So I know we trained some folks in California, and then it seemed like there was, unbeknownst to them, a state mandate that like our model was not included in their state mandate of what like wraparound could look like. And so we're kind of in these new conversations with all of these bodies to really be trying to articulate like this is what this program is, and this is what the benefit is to families, and this is why this evidence-based practice like should be considered as something that might be insurance billable, or should be considered as something that like the state would want to offer for people. And maybe you can help me articulate that a little bit better, but that's what's coming to mind for me, I think, in different ways for different groups.
I was thinking very similar things. I wanted to say, first of all, that I think wraparound is so successful because Hennepin County has made significant investments in it.
Yeah.
And has been a co-creating thought partner all the way through. I think a lot of times you go into like a new setting or a new jurisdiction and they're like, oh, we'll refer families to wraparound. And it's like a handoff. We'll give you the family and you work with the family. And Hennepin has been very strong in recognizing that we continue to work together as partners to support a family. So a probation officer is invested in working on the team, or a children's mental health case manager might be very involved in the team. So I think where we're seeing some of the most success is in other jurisdictions. Like we've been doing some work with the Leech Lake Tribal Council, where the leadership has huge buy-in and is like really recognizing that they have a role in kind of co-creating the partnership and the work and how it is sustained. So I think those are critical things. Are there other questions? I know we're right at our time, so I want to respect everybody's time today. And again, I'd like to thank you all for joining us for today's call. Please stay tuned for upcoming news and announcements by signing up for our monthly newsletter on our website. I'd also like to announce that in September, we're partnering with Dual Citizen Brewing to raise awareness and funds through a variety of events, culminating in a really fun bingo night on September 24th. Dual Citizen is generously matching up to $10,000 in funds raised at our events, so we really hope you'll join us to double your impact in September. Registration will open in early August. Thank you, Susie, for such great insight into kind of this new work that we're leaning into. And thank you, everyone, for joining us. We hope to see you at Dual Citizen and at the next CEO call in October. Have a great day.
Thank you.
Thank you.
Thanks, everybody.